Hello, everyone, and welcome to today's webinar, 2020 State of Healthcare, Breaking Down the Trends and Innovations in Digital Health, sponsored by Validic. I am Mimi Hayes, and I'm your moderator for this event. A few items before we begin. The webcast is being streamed through your computer, so there is no dial-in number. For the best audio quality, please make sure your sound is up. This webinar is being recorded and will be available on demand within 24 hours after the event. Time permitting, we will follow the presentations with a Q&A session. Please submit your questions using the Questions and Answers tab on the left side of your screen. With that, let's begin. We have with us three incredible and esteemed speakers with us today that I would like to introduce. First, we have Drew Schiller. Drew is the Chief Executive Officer and co-founder of Validic, the market leader in platform solutions for personal health data. Drew is solving foundational data and workflow challenges in healthcare, connecting data from patients' in-home clinical and consumer health devices with the provider or health plan. With the mission to improve the quality of human life through technology that makes personal data actionable, Validic is helping power health and wellness programs for millions with organizations like Kaiser Permanente, Optum, Weight Watchers, and of course, Humana and Cleveland Clinic. Thanks for being here today, Drew. We also have with us, great. We also have with us Dr. Peter Rasmussen. Dr. Rasmussen is the Medical Director of Digital Health and Professor of Neurosurgery in the Cerebrovascular Center at the Cleveland Clinic. As Medical Director of Digital Health, he is charged with guiding the clinic's overall digital health strategy, as well as the implementation of their digital medicine portal, Express Care Online, which is the clinic's virtual portal for on-demand, scheduled, and new remote consultation services. Thank you for joining us today, Dr. Rasmussen.
Pleasure.
Oh, great. We also have Jeff Reid joining us today. Jeff is the Senior Vice President of Humana Wellness Solutions, and he is responsible for leading Humana's wellness business. Jeff leads a team focused on using behavior science, consumer data, and digital solutions to improve population health. Jeff oversees Humana's wellness and reward solution, including its flagship offering, Go 365, which is a nationally recognized rewards and incentives program that encourages members to make healthy lifestyle choices. Thank you for joining us today, Jeff.
Nice to be here.
I'm looking forward to this conversation. We're going to discuss everything, including new data sources to measure personal health and social needs, how Medicare Advantage plans will operate in the future, why new market entrants are driving innovation, and where we can expect to see investments from CMS. With an election on the horizon and healthcare at the forefront of social and political conversations, our panelists will be breaking down the key trends, innovations, and status quos for the year ahead. We have some slated questions drafted for our speakers today, and we urge you, our audience, to submit your own questions for Drew, Dr. Rasmussen, and Jeff using the Q&A box on the left side of your screen. So let's dive into today's topics. Healthcare is no longer relying solely on standard clinical measures or data generated in the clinical setting to guide treatment decisions. Continuous monitoring provided by wearables and smartphone apps gives healthcare access to ongoing data reflective of a person's lifestyle and behavior. This whole health or total health approach to wellness and care is driving better treatments and outcomes for populations. Drew, let's begin with you. Why is healthcare moving towards the measurement of total health, whole health? What new data are being sought as a result?
Yeah, absolutely. Great question, and appreciate the opportunity. You know, I think one of the things that excites me so much about my co-panelists that we have here today is that we have Jeff Reid from Humana, who really focuses on the health incentive side of the health plan space, and Dr. Rasmussen, who really focuses on care delivery and how patients can receive better care in a remote monitoring context. And those two worlds are actually starting to come closer and closer. And I think this question really starts to get the crux of it. So if you think 5 years ago, organizations like Humana and Cleveland Clinic, and I'm not speaking on behalf of them, more just speaking in general terms, but using them as examples, were really focused on utilizing the data that they had available. So our clients were really focused on, claims data if they were a health plan, and really maximizing the value of the claims data that they had, and the health system side really maximizing the usage of the utilization of the EMR data that they had on patients. However, over the last few years, I think this has been driven in part due to value-based care initiatives, but there's been a really big shift to understand more of what's happening in people's daily lives, and that's including other types of data, so combining claims and EMR and labs, but then also bringing to bear data like social determinants and also personal health data, and that can be from wearable devices, but also in-home monitoring devices, as well as health apps on the phone that are tracking daily behaviors. And the reason is that these data, when you combine them, create a whole picture of what's actually happening with an individual. And the benefit is that it allows us to personalize interventions and deliver care that's going to be really personally meaningful to the individuals receiving that care, and will ultimately drive healthier behaviors and improve outcomes. So I think that, whereas population health really used to look at population stratification, now we're starting to look at stratification for interventions, but the data on individuals to help customize and tailor those interventions to to deliver care that's really meaningful for that individual person.
Great. Continuing to dig into this idea, Dr. Rasmussen, in what ways do you see the use of social needs and personal health data driving advancements in health equity?
Well, we're very interested in data that's being generated and acquired from patients at home. And for many years, we've been working in the space of patient-generated data and acquiring the data around social determinants of health and aggregating and integrating that into our clinical portfolio of information about our patients. So we've been pleased with our partnership with Validic to date, and our ability to bring in generated data both through consumer-grade devices that we've supplied to our patients, as well as to work with tools such as patient questionnaires that we pushed out to them through our mobile app. This really allows us to provide a better picture of the patient and understand what their needs are and what their risk assessment is going to be for readmission or needs for aftercare after hospitalization, like skilled nursing facilities or other facilities. In addition, we've been using patient-generated data to really help manage a more chronically ill or potentially chronically ill patient population. So I think a lot of what I've heard talk about so far is focusing on wellness initiatives. We've found tremendous traction with our clinicians in using connected devices in patients who are sick. So as an example, in my own practice as a stroke surgeon, many patients are affected because they have chronic hypertension. And what we traditionally do is just send patients out after hospitalization, hoping that the blood pressure regimen that we've guessed for these patients is going to work, but we really have no idea what the success is. And clearly a good percentage of patients get readmitted to the hospital subsequently because of poor blood pressure control or medication adherence. And by using such things as connected blood pressure cuffs, we're able to really fine-tune the management of these patients, and have shown good improvement in medication adherence and disease control.
This is Jeff Reid. I'd like to add a bit to the conversation around how Humana has started to think differently about individual data, connected clinical data to drive better outcomes for our members. As the earlier speakers were talking about, there are so many use cases in which this data, when combined, can provide powerful outcomes, for Americans as we're looking for, better healthcare decisions to be made. And some of the examples of that we're testing is our ability to take consumer-generated information that we collect through devices and through surveys and commentary that we collect through digital engaged experiences, and starting to pass that along with a consumer's permission to care providers as we visit in the home. It's pretty interesting to be able to see a senior in a home as an example, and be able to know that they were active the day before, or that they, completed a couple of the goals that may have been set for them, and to use that moment to encourage them to continue that activity. The opportunity is taking the data that we've so often been collecting for the last few years, and in many cases creating more edutainment and more activity for the individual to take action, and starting to combine that with other clinical data to drive outcomes and better decisions, and specifically when we're meeting with members in the home.
Yeah, totally, Jeff. And building on that, this is Drew. Building on that really briefly, on the other side, when you think about certainly using the data for personal engagement on the consumer side is critical. We can also use the data to help the clinicians engage in the right way. To Dr. Rasmussen's point. So, when Peter was talking about clinicians using this to help monitor folks who may not be managing their blood pressure very well, being able to proactively let a care team know that this particular individual hasn't recorded a reading in a certain number of days, or the blood pressure readings that there's a concerning trend over time, and raising up those alerts so that the care team doesn't have to worry about reaching out to all of the patients in a program and finding out what's going on, but instead of spending their time checking in, they can actually spend more time helping out with just the individuals who really need the extra care and attention. I think that's another really critical piece of this too, is to help. You can tailor individual interventions by helping the clinicians understand who to focus on.
Terrific. Our second topic centers on how roles will continue to blur between payers, providers, and new market entrants into and beyond 2020. How will this shift drive consumers' competition and innovation with data?
Well, this is Jeff. I'll start answering the question, and certainly welcome comments from my panel participants. What's pretty staggering to me is that if you look at 2019, the spend in healthcare is going to approach $3.8 trillion. Pretty big number, and so there's a lot of room for a lot of participants to drive innovation and partnership and competition, of course. And I've been pretty intrigued with how the retail organizations are moving into healthcare. We've had a lot of conversations with companies like Google, Walmart, and Best Buy, and they have done a fair amount of work trying to figure out how to use healthcare as a lever to further engage their constituents, and then also how they can be a player in driving more access to care. One thing that you quickly learn when you enter the healthcare industry is that healthcare is very local. And if you look at healthcare being local, it's not only in working with local hospitals or with providers that are traditionally providing the service. Retailers are setting up their own clinics and their own access points to drive more customer engagement with their day-to-day health needs. Recently, Walmart opened their first clinic in the state of Georgia, where they're offering PCP care and typical diagnostic services, with a primary focus of bringing down the price point of those basic healthcare needs for the constituents and the customers that are their core audience. What's also interesting is that with the innovation of bringing healthcare closer to a retail experience, I'm very intrigued with the advent of these concierge services that are also in these clinics. An example of that, Humana recently established a partnership with Walgreens in Kansas City. And as part of that partnership, we set up a concierge health navigator desk right there in the retail store. And it's used by Humana members or just Walgreens customers to help access, navigate, get general information about questions, but even more and more also asking about how they navigate the use of digital tools to engage in their health. So there's something that's a pretty neat role for, I think, a lot of these retailers to play. I think Best Buy and Apple have an interesting model with Best Buy's Geek Squad, and with the stores that Apple's also have self-help capabilities with their help desk. So imagine turning that into a healthcare focus. And I think there's going to be a lot of innovation of driving those types of care services with navigators that are sitting in some of these retail locations. And for seniors, as we start to use more technology to drive access to care in the home, there's going to be more need of how do I do this and how do I connect this information to make sure that I'm comfortable in using the technology. I think there's a lot of services that are to come to help navigate the scary place that a lot of these seniors will see as they're figuring out how to navigate the healthcare picture as they use more and more digital services. So I'm pretty excited about the new competition and partnership that retailers getting involved in this market will bring innovation towards the consumer experience.
Now, speaking from a traditional healthcare delivery system, we're really, which was grounded in patients coming to our facilities, our offices for standard evaluation and management type services. We've really had to start to pay attention now to the increasing consumerism that's coming along in medicine among patients and trying to meet their expectations in healthcare like any other consumer has working with any other business. Something as simple as online scheduling into appointments was really an unknown idea to us 2 to 3 years ago, and we've had to work hard in a very short period of time to do such things as allow patients to schedule appointments online without making a phone call to the office or the call center, and to automatically put patients on wait lists, which are just really standard in many other industries. In addition, it's only been up to the last 2 weeks where we've really launched our own branded mobile app for our patients and not latching on to Epic's MyChart like many other areas. We recognize that digital tools are very important for patients and their engagement. This is an expectation amongst certainly younger generations and even older generations that digital tools be available to help track their health and to access health care. And to that end, to try to make it more friendly for our patients, we've instituted things very similar to Apple-style Genius bars in our main campus hospital. So when patients are prescribed, if you will, digital tools like our mobile app or virtual video visits or connected devices like blood pressure cuffs or scales or remote cardiac monitoring devices, we have a patient-facing, very patient-friendly team of individuals who are there to help our patients get set up on these digital tools that we can extend the reach of our care into the patient's home.
I think you bring up some good points there, and I think the rubber will meet the road when our customers start to need to interact outside of the ecosystem that we own. You gave great examples of the hospital system of where the experience can be controlled from scheduling to the services that go across the provider network that you're connected to. But the moment the customer or the patient moves to a different part of their healthcare experience at a pharmacy that's not connected or to a PCP that is outside of the network, that is where the opportunity becomes a little bit harder to serve, and where appointment scheduling and the ability to move information in an interoperable way becomes harder for us to deliver this integrated experience. And I think those that are entering healthcare are going to see these problems pretty quickly, as those have been serving patients in this industry for a while. So the examples of the Walmart and the Googles of the world, they'll do quite well when it comes to the information that are created and maintained in the systems that they create. But when you go outside of that, that's where it's going to be harder. And so, our initial conversations with some of these early entrants, they're already coming up against that. And so the big trend around interoperability of data becomes the holy grail in my mind that needs to be solved in order for these retail-like experience to be persistent across the whole healthcare journey. And I think that's something that we as an industry have a lot of work to do. There's tons of innovation and effort going in interoperability, but more work to be done around standardization and government's role in driving that adoption at a quickened pace.
Yeah,
there's no question.
Oh, go ahead, Peter.
Oh, I'm sorry, Drew. I was just, there's no question. I think there's some role for government and policy in helping out with interoperability and standards there. At the same time, I don't think healthcare systems can wait for that to happen, for those standards to be implemented. And that's one of the very nice things about a solution like Validic. When we approached our physicians 5 to 6 years ago about remote monitoring programs at home, what became very clear to us is that they really weren't interested in getting data in isolation from the patients in their home, like just getting a stream of blood pressures coming in or a series of weights for patients that we're monitoring for weight management purposes. They were very insistent that the data be intercalated into our electronic health record. And developing that kind of interface was crucial. It took us some time to do that. And clearly it's much more robust, now that we've been working with Validic. So I think it's nice if it's going to be mandated at a policy level, but at the same time, there's solutions that exist today, and there's no need to wait for that.
Yeah, totally, Peter. And building on that, what's exciting for me about the consumer-focused companies that are really entering healthcare is that by and large, we're seeing partnerships rather than folks trying to, come in and quote unquote disrupt from the outside. So, some of the public examples of this, I think, would be, the clinic, which is the Cleveland Clinic and American Well partnership, or actually joint venture, where they're bringing, best-in-class technology and clinicians to bear to drive some new initiatives. And I can speak at a very high level on some of the initiatives and conversations we've been involved with Humana, where there are some learnings and consumer engagement strategies that are being brought to bear from the traditional retail space and brought into healthcare in new ways that, frankly, no single company could deliver a solution like this on its own. But when you combine a great healthcare company with a great consumer company, consumer engagement company, the combined results end up being something that is definitely greater than the sum of its parts. And that's what I'm really excited for and bullish on when I think about how these new initiatives can really start to move the needle in healthcare and engage folks in new ways.
Drew, what do you see as the largest barrier for health plans and systems trying to innovate with technology?
Yeah. So shifting gears, one of the biggest barriers I see to this technology-driven innovation is really operational infrastructure and capabilities and focus to actually implement these solutions. There are, as Peter mentioned when he was talking about, the number of things that they have to consider. Just for example, automatic scheduling of appointments. There are a lot of competing priorities internally inside of health plans and health systems. But what I will say is when personnel operations are prioritized to implement these kind of solutions, the programs themselves have a dramatic improvement on patient care. And so one example of this is one of our clients is a large IDN, and they really focused when implementing a remote monitoring solution on how to operationally implement a consumer-focused strategy. And they've seen fantastic results, like a full point drop in A1C for their diabetic patients within a few months' time, a reduction in call times for their care managers of over 60%. 88% of the physicians who have patients enrolled in the program say that the program saves them time, just on across the board, just tons of fantastic results. But really the technology that we implemented with them was by and large straightforward. Like there was no machine learning and AI was part of the solution. It was really, just a very well-defined, well-run technology solution that had a really strong operational basis. I mean, the key components of the success of the program were that the technology was embedded in the workflow, so there was there's no new behaviors that the care team and clinical staff had to learn. And second was that there's a really strong operating plan across the organization so that everyone knew their role in the program and how to drive value for patients. And I think what we're seeing is that folks are starting to develop their operational chops for implementing these programs, but that's really where we have to get to in order to be able to scale these programs, because the programs that Validic has been a part of at least have shown strong clinical success and the ability to actually improve outcomes for patients, but only when the operational strategies are in place from the health plans and health systems.
It's pretty interesting as we think about this interoperability question. We also find that there's a large opportunity to figure it out for the caregiver. As more and more decisions are made as a family, or you have a loved one going through the process with you, one of the big barriers is the ability to share private information, to have the right permissions, and to keep those permissions current for the interoperability of the conversation between a care team. And so Humana has worked pretty diligently over the last couple of years to strengthen our ability to provide access to caregivers as they are shepherding their loved one through their care regime. So I guess, Drew, as you think about Validic's role in sharing information and creating the mechanisms to do that, have you seen a lot of conversation around how that's being driven for caregivers?
Yeah, absolutely. It's one of the things that we get asked about and talk about quite a lot. It's one thing to surface the data that can be useful for clinical teams, and it's another for patients. But you're right, it's also important for caregivers. And the way that we tend to think about this at Validic is we try to surface the right data for care teams. And care teams, there's a clinical staff component of care teams, but there's also a patient-focused, I should say a family member focused caregiver on the care teams as well. And so, one of the things that we're doing internally is working really hard on how we can. I'll say this: we haven't nailed the answer there, but we are actively thinking really hard on how to solve the problem, and I think we're zeroing in on a solution there soon. But we are actively talking with our partners like Humana on, what does the care team experience look like for you? Like, how would you like to partner in developing this kind of solution? Yeah, I think you hit the nail on the head there, Jeff.
And from a health system standpoint, there are two big barriers that really loom for us. One is payment and reimbursement. Fortunately, the AMA has put forward a pretty robust portfolio, or is in the process of putting forward a robust portfolio of CPT codes to account for a lot of the digital health behavior that's happening now or being contemplated for the near future. So that will certainly help to advance some of the payment issues. Things like remote patient monitoring, which I think is very beneficial to patients, is now a service that has CPT codes, and CMS has begun coverage for this. It's not perfect. There's still some limitations in the codes there. They could be a little bit more robust than what they are, particularly around place of service, but it is improving and getting better. Other areas where we've had difficulty in our system driving change is really at the, I would say, the mid-level clinical leadership level. So we've enjoyed very strong CEO support in our organization, both with our current CEO and our previous CEO, Toby Cosgrove, who really got us launched on a current modern era of digital revolution. And the frontline caregivers at the Cleveland Clinic, the physicians and the advanced practice providers, we're all employed providers in our organization, and we'll effectively just do what our managers and our bosses will do. That leadership level commitment is not always translating down to the lower levels, and there certainly is some resistance amongst some, not all, of the clinical leadership. Those problems are slowly being solved. In those areas where we've seen very strong clinical leadership adoption, we've seen great innovation in how care has been delivered, and really some tremendous improvements for our patients.
Terrific. Our third and final trend focuses on new care delivery models. I'm curious how our panelists think new health plan offerings will advance the drive to value-based care in the upcoming year. Jeff, Medicare Advantage now covers 1/3 of Medicare beneficiaries, and that number continues to grow year over year. What do we expect from Medicare Advantage of the future?
I think you can expect a lot of change in Medicare Advantage of the future. It's quite staggering that there are over 10,000 Americans that age in at 65 every day. So there is a lot of people that will be looking for healthcare solutions over the age of 65 now, and projected over the next 10 to 15 years for sure. Medicare Advantage, traditionally has been developed, and often in the insurance industry we talk about it by a set of contracts. For instance, in the state of Tennessee, when you have a Medicare Advantage policy, we have to provide access to all care types, all capabilities in the same way for each member that is part of that plan. And while that makes sense, making sure that everyone gets fair access to the same care, it also can be limiting in your ability to provide specific solutions as you are focusing on care management, specifically around chronic diseases. Humana's strategy focuses on creating a system that drives integrated care delivery model. And in doing so, it requires us to use our know-how and analytics to drive the right care for the right person at the right time. And so as you're thinking about Medicare Advantage of the future, I think you will see more of our ability to take advantage of providing specific care capabilities for those that are managing very unique chronic conditions. So I think that's one thing that you will see dramatically change. There's a lot of test and learns in the system today to offer different incentives, offer care management techniques that will lead us to, I think, the right path to provide a more personalized care. I think the second trend that you will see around Medicare Advantage, I was speaking to it earlier, was the more sharing of data and interoperability. CMS just last year introduced the blue button and the APIs behind it so that anyone participating in the healthcare experience after they receive permission from a patient or a customer is able to get access to prescription records, treatment records, anything that CMS collects in order to drive billing or care. That information is now readily available. So it opens up a plethora of new services and capabilities that ultimately help all of us create better care solutions for members. So I would say Medicare Advantage of the future will certainly have more interoperable components and will provide more connectivity of the partner system required to deliver care. And so that includes, the usual suspects, but it also includes new entrants, such as these retail organizations we were discussing earlier. More unpaid caregivers being able to provide their services because the integration of the data. So interoperability, I think, becomes another big trend for Medicare Advantage. You also have heard a lot of politicians talking about the expanding of Medicare access for all. Often is what you hear. And I think there's a lot to like for the ability to take what's working in our Medicare Advantage products and provide broader access. So I think you'll see more expansive use of Medicare Advantage as we look to provide more solutions to give healthcare to more individuals. So those are some of the things that we see as this product evolves and becomes more important in how we provide healthcare for our seniors.
Any other thoughts from any other guests? Okay. For our final question, Drew, with condition management programs moving to the home, what strategies and tactics have you seen most effective in driving better outcomes?
Yeah, totally. I'll say, Jeff, you really nailed that Medicare Advantage point, so thanks. I don't think it's surprising that Peter and I didn't have a lot to pile on there. Extremely thorough and thoughtful answer there. In terms of the prioritization of condition management, one of the key strategies that we see driving outcomes and how data can help care delivery organizations partner with patients and their family caregivers for improved health and drive new kinds of conversations is really by bringing the data to bear in new ways. And so I'll give you an example here with a story. So there's a gentleman who went through one of our programs early on. He's a type 2 diabetic who had uncontrolled diabetes for over a decade. And during that time, he would go see his endocrinologist, and every quarter, every 3 months, he'd go in and get his A1C test, and every 3 months, he would get his lab results back that would say that his A1C was had again increased or was again not under control. His A1C at the time was around 9.5, and he's really unhealthy, and he was extremely frustrated. And the conversation with his endocrinologist at that time was effectively, what more can I be doing? How can I get this under control? And the endocrinologist kept saying, well, listen, you have to eat healthier. It's pretty basic. You have to eat healthier. You have to exercise. And this guy, Steve, real person, he said, that's exactly what I'm doing. That's what I'm trying to do. And Steve was extremely frustrated. His family was really frustrated. He actually started to really just hate his life because he was just always sick and never felt like he had any energy to do anything. And the challenge was that his endocrinologist didn't have any other data to provide additional feedback for Steve. And so it was a really one-way sort of paternalistic conversation. And so Steve actually left that physician and went to another physician and happened to get enrolled. As part of that, happened to get enrolled in a diabetes management program that Validic was a part of. And so from there, the data from his blood glucose monitor as well as his blood pressure monitor, he's put on a blood pressure monitor and given a nutrition tracking app as well as an activity tracker. And all the data came into the electronic health record in a total program of care. And immediately the conversation started to change for Steve, because it wasn't about what can I be doing? Well, you need to eat healthier. It was, we see that you're trying to eat healthy. Here are some suggestions we have. And one of the suggestions actually ended up completely changing Steve's life, which was about a month into the program. They were looking at the data, and one of the care managers noticed that Steve's glucose levels were spiking in the evenings, but he wasn't recording any food. And so they asked about it, and it turns out that Steve was eating popcorn. Now, Steve thought this was okay because it was calorie-free, no butter, no salt, just plain popcorn. But so he didn't log anything. But the care manager said, Steve, that's probably what's causing your glucose spikes. And so Steve cut out eating popcorn in the evenings, and within a month, his A1C dropped by a point. And it was the first time that he'd ever made a behavior change that actually improved his health that directly. And it started unlocking him, or opening his eyes to how he could use data to unlock the behavior changes that would actually improve his quality of life. And it changed the conversation that he was able to have with his care team in a totally new way, to where they could really just talk about the data. And he could say, I'm struggling with my data here, or I see problems here. How can we address this? Rather than looking at a rear-looking lab value and trying to adjust conversations, or trying to adjust medications that way. So, over the course of a few years now, since Steve's been in the program, he actually went from a 9.5 A1C down to a 6, which is his lifelong goal. He has dropped a ton of weight. He looks great. He has a ton of energy, and it's all because of the fact that there was data to bear to really drive a different kind of conversation. And so I really think it's a personal story about the power of how data can really truly drive new and meaningful ways of engagement between the care delivery organization and the patients and their family caregivers, and how they can engage in their health.
I think that story is so inspiring, and we hear a lot of those same accolades when someone truly figures out how these connected devices can deliver life-saving outcomes because someone is paying attention to the data that it's throwing off. We often hear stories where members of Go365 they go to the doctor and they find out for the first time that they have heart disease or another condition that's going to be a lifelong journey for them. And they use these connected devices or these programs to ultimately jumpstart their new life. There's a person that sells actually healthcare insurance in the state of Louisiana that I met with recently. And, his story was he used the Go365 to motivate him, to set up his program, to have competitions among his office employees, and to keep himself on track. And he shared his data with his family through their connected devices, and through this friendly competition, they were able to keep on track with his chronic disease of heart disease. So, condition management can really have a very good success story when you integrate data and you use it through the care system. And I think there's more to come with that as consumers become more comfortable with sharing their information, and as the interoperability of our systems creates ways to ingest that information so that we can connect it with clinical information to drive better outcomes. So it's a great story.
And the outcomes can be quite varied. So one of our key outcomes in our organization is access to care and improvement in patient experience. And one of the connected device programs that we've been working on in the past couple of years is a post-bone marrow transplant monitoring program. And what our program likes to do is, for the first 4 months after your bone marrow transplant, is to bring the patients back into clinic every day to measure temperature and blood pressure and make sure the patients are generally healthy. Of course, these patients are immunosuppressed and prone to infection, and the anti-rejection medications can give patients high blood pressure. And we've been able to convert a significant percentage of those patients over to home management with connected devices. And consequently, this is better care for patients because we're not bringing immunocompromised patients into a potentially dangerous bacteriological environment for these patients. That's better experience for them because they don't need to come back to the office every day. They can stay at home and just electronically transmit their data. And it frees up office appointment slots with the hematologists for other patients. So there's a variety of ways that these types of programs can drive many different types of outcomes.
Yeah, absolutely. Thanks, Peter. And I think the common theme here between all of these stories here is that there's a program of care that the patient and the care team and the caregivers are all on board with, right? And so even in the example of the individual in Louisiana with the Go 365 program, there was a program of care, so to speak, that he got his family members involved with, and so there was accountability. And I think that level of understanding what the outcomes are and understanding the accountability and who is accountable for what is really critical in being able to drive the efficacy of these programs. The programs that we've seen that are not successful are when an individual is given a device or put into some sort of protocol, and they don't really understand what they're supposed to get out of it, or really why they're tracking their data, or what that ultimately is going to matter for their health. And I know that sounds a little bit ludicrous to say, but we've seen programs that are rolled out in that way, without much of a thought to what the after experience is, what the after experience is once someone has a device. But the successful programs we've been happy to be a part of all have the common mix of having a really thorough program of care designed up front. And in the onboarding or initiation process, there are really clear expectations and goals set up front for what everyone wants to get out of it and how folks will be held accountable. Whether that's, I love the story of the accountability with family members. We've also seen with some of our clients really strong accountability where, if somebody doesn't record a reading, they're going to get a notification from the system every 24 hours. That doesn't happen. But if somebody in a remote monitoring program doesn't record a reading for a week, the care team is actually going to get notified, and they're going to get a call from the care managers saying, "Hey, we noticed that you're pretty far out of compliance here. What's going on?" And as a result, the compliance is actually pretty high because the individuals in the program know what to expect up front, that, oh yeah, if I don't do this, I'm actually letting somebody down, and I'm actually going to get a phone call about this. And so I agreed to participate in the program. I need to do my part. So I think that program of care, I really want to underscore, that's the common theme that is driving success here.
And I think, Drew, another common theme is that none of us talked about anyone getting a device or joining a program just to get an incentive. Now, don't get me wrong, in the Go 365 program, we certainly use financial incentives to drive behavior change, and it does work. It works, though, to a point. At the end of the day, it has to come from self-motivation, and ultimately peer pressure has a big role to play as well. And in all of the stories that we shared, it was about the ecosystem driving the encouragement for you to want to do good and do the best job. And a lot of times those incentives can get you started, but we've tracked Humana employees over the last 6 years that's been part of Go 365, and the initial 1 and 2 year results are fantastic, where your absenteeism is down, claims costs are down. But over time, the motivation has to come from the individual, and so a lot of our program attributes over 3 to 4 years is more moving them towards self payment, if you will, to drive the motivation. So I think there's a lot of room for all of these type of incentives to work to get consumers to make the best healthcare decisions. But at the end of the day, the best medicine is your own self-motivation.
Thank you, Dr. Rasmussen, Jeff, and Drew. That was a very lively discussion. A lot of great insights were shared. We're now going to move on to our audience-submitted questions and answer session. It is your time to ask the panelists any burning questions on your mind. As a reminder, you can still submit these questions in the Q&A box on the left side of your screen. All right, we have a lot of insightful questions, so we're going to try to get to as many as possible. Here's the first question. How does an organization ingest data from dozens of sources of data from a member and turn that into something actionable for a care manager instead of just overwhelming data on a screen?
This is Peter. I can take that from our perspective. What we've done is when patients are sending us data, patient-generated data from home, whether it's through connected devices or through periodic questionnaires, we strive to integrate all of that into the electronic health record. Once it's all in the electronic health record, then we've created a series of dashboards for our care managers that presents to them the relevant data for whatever concern that person may have. So as an example, we have a specific dashboard for patients with high blood pressure, those in the bone marrow transplant program, those in a weight management program, et cetera. And then we back that up with clinical decision support tools that analyzes that data. And I wouldn't say it rises to the level of AI or ML or anything like this. There's some relatively simple tools that can be put in background to help raise alerts for those patients who seem to be out of bounds. So as Drew mentioned, things like missed readings for several days or blood pressures that are clearly above some threshold that our clinician sets for those patients. Those patients get color-coded and flagged in that care manager dashboard. So a single person, a single care manager can manage hundreds of patients because there is some flagging and some clinical decision support that goes on behind the scenes.
Yeah, and thanks for that, Peter. And I think that's the exact right approach. And at the risk of hawking my wares, this is exactly what Validic can do in terms of bringing in data from multiple sources. And without belaboring the point too much, we have the ability to have dashboards to view the data in the right way, but then we have a very simple program management workflow to set up alerts and triggers, and that way if there's something to be concerned that you might be concerned about, you can set a trigger to send something up into the via secure message into like an in-basket or some sort of other workflow for your care team when they need to pay attention to an alert versus when everything is fine, they can always view all the data via a very well laid out dashboard. We also have on our dashboards the ability to just see readings that are outside of a range and to group readings in different ways. So for example, with glucose, you can view a trend line, but you can also view times of day, groupings by times of day. So just, being able to have very simple to use tools that allow you to interpret the data in a sophisticated way is sort of how we think about really separating that signal to noise for care managers, and it's something that we put a lot of thought on into at Validic.
And I can add on Humana's experience. We certainly have spent a lot of effort putting together customer-specific dashboards and clinician dashboards that try to bring all the data that we collect together to give the clinician that maybe in a home as an example, the best shot to be able to have a holistic view. But one thing we do find that it's important as we do share data is that we always speak of the next best step. There are so many things that we collect, but at the end of the day, for the consumer, specifically those that are over age 65, they do best when you give them that one next best step to take. So we work hard to make sure that our dashboards and the data that we provide for clinicians that gives them the information for them to make that next best step recommendation. I think that's important to getting consumers to ingest the data and take the action.
Jeff, this is Peter. Can you give an example of what that next best step might look like?
Yeah, so for consumers, if you're on a program for diabetes, you create. We have a recommendation for you to do once you complete that. Instead of giving you 3 or 4 different actions for you to take, we usually just give you one, and that we've had the most success getting someone to take that next best step. An example also is in foot care with those that are diabetic and managing foot ulcers or trying to avoid them. We've determined that sometimes instead of giving 3 or 4 things for you to go do with your feet, let's take that next best step. And as a result, we're able to drive less frequency of foot ulcers in the folks that have participated in our trial. So those are 2 examples.
This question is for Dr. Rasmussen. Given the drive to value-based care, where would you like to see deeper investments being made by CMS to help it or advance this transition? How much does reimbursement from CMS drive programming or investment?
Yeah, I tried to touch on this answer earlier. Definitely it would be a broadening of the CPT codes that are available to embrace digital care behavior, and eliminating some of the barriers. So as an example, up until recently, location of service was a barrier to reimbursement. And I think many of these things are being removed or contemplating to be removed in the near future. So that's helpful. From our standpoint, reimbursement is not a major driver for adoption. A lot of work that we just try to do is to create a better experience for our patient and our caregivers and better way of delivering care. And we think reimbursement and business and other things just follows from that. Those aren't our major barriers for digital adoption in our organization is reimbursement. But clearly anything we can do to free up the ability to innovate on care delivery from a reimbursement standpoint is definitely welcome.
Great. So the next question kind of builds on that last question. If you had a magic wand and could immediately remove a major barrier to adoption of digital clinical technologies, what barrier would you remove?
Well, this is Jeff. I'll start. I think the interoperability question or answer is where I would start. Standardization of data, the reduction of barriers, whether it's laws or an unwillingness for folks to share for proprietary reasons. That would be the wand that I would wave to integrate that so that across the ecosystem, the ease of flow of data could be used to drive the best care at the right point of time.
Yeah, I would certainly welcome better data interoperability and image portability. No question about it. I think that would do a lot to raise the quality of care in certain locations and enable our patients to seek second opinions or additional opinion much easier than they currently do, because the medical records and the data would flow broadly or widely. In our organization, really the major barrier is just a willingness to change and deliver care in different ways. That could be at the leadership level or it could be at the individual caregiver level. And just yesterday I was having a conversation with one of our top hematologists about doing a video visit with a patient. And his response was, "I'm just not comfortable with the video visit. I'd be much more comfortable just doing it by telephone." So it's these kinds of relatively simple fears and behavior changes that would be great to solve.
Yeah, Peter, that last comment you made about the concerns over change, I think was exactly where I was going to head. And so rather than pile on, I'll just sort of build on that point, which is to say that I think that what one of the things that we see is that folks are often so busy, especially physicians and clinical team members are often so busy in their day-to-day that it's actually really difficult for them to even fathom changing in any way because change means more time. And so just getting up to speed, I think is really a challenge. And so if there were a way to somehow operationally embrace change in a way that was supportive of the care teams and understanding that they already have full caseloads, but this is an investment in the future. Being able to do that in a way that supports everybody, I think, would be the way I'd sort of build on that point.
Fantastic. Well, it looks like we're out of time for today. Thank you for attending this Fierce Healthcare webinar and submitting your questions. I'd like to thank our speakers for participating in today's webinar and the insights shared. This webinar has been recorded. You'll be emailed the link to the recording in the next 24 hours. Thank you again for joining, and we look forward to seeing you at future events.